Hi, my name is Dr. Joe Childs, and if you suffer with migraine headaches or chronic tension headaches, you know how frustrating they can be, how impactful they can be on your day-to-day life, how they can affect your concentration at work, your social time with your friends and family. When I was younger, my mother used to have migraine headaches, and I can remember how frustrating it used to be, how they'd come on at inopportune times. They used to come on, it seemed like, every time we had a holiday, every time we'd have our family over, or when my mom was trying to cook a meal. I could always tell when she'd have the headaches because she'd have to sit down in a dark room. So I understand migraines can be very impactful in your life. So if you've tried all the medications, you've tried all the other approaches, and you're still frustrated, what I'd like to consider, or what I'd like you to consider, is have you gotten to the root cause of the problem? You see, migraines are due to changes in the diameter of blood vessels in your brain. Certain parts of your brain, under certain circumstances, have an increased demand for oxygen. And when that demand for oxygen is not being met by increased blood supply, what will happen is you'll get the prodrome. You'll get what's called an aura. You'll know that the migraine's coming on. Some people get little flashes of light. Some people will smell smells or odors that aren't there. And then eventually what happens is the blood supply eventually gets there. And when it gets there in an overabundant amount. And the blood vessels actually dilate too much. And when they dilate too much, what happens is they stretch the painful nerve endings that are wrapped around the blood vessel. And that's when that headache comes on. That's when that throbbing migraine, that ice pick in the back of the eye. So what research is finding is that migraines are due to areas of the brain that are not functioning or firing properly. The big areas of the brain that research is looking at are the frontal lobes. When the frontal lobes aren't firing well, certain areas in the back of your brain are not being inhibited, and that demand for oxygen increases. The other area that they find is causing migraine headaches is the lower brainstem and the upper brainstem that's firing too much, or the lower brainstem that's firing too little. So in our office, we address migraines neurologically, metabolically, and biomechanically. And we look at all these areas. Patients with chronic tension headaches, a lot of times they're due to biomechanical problems in the cervical spine. Areas where pressure builds up that affects not only the neck area, but it also affects the pain nerves of the head and creates chronic tension headaches. So what we do is we want to look at all these areas. In our approach, in our office, we have a unique approach in that we do brain-based therapy, we do biomechanical care, we do metabolic care. So one of the big things that we do in our office is we put patients on oxygen therapy. When patients come in with migraines, oxygen therapy is very important. It gets the brain firing better. The other thing that we do is we do unilateral neurological brain-based adjusting. Just the other day we had a young lady come into our office, and she had a very bad migraine going on at the time. And I could tell that she had a migraine going on because she had the sunglasses on. And so I evaluated her. I took a look at her brain and nervous system with some specific testing. And what I found out was that the one side of her brain was really under firing. And so we did some unilateral adjusting. We put her on some light oxygen therapy, and it was amazing. You could see the pain just lift off her face. She started to smile, and the migraine really lifted off of her. Now, she didn't feel 100% better, but it was amazing the change. And we see this all the time in our office with lots of different conditions, and migraines are one of them. So it's our unique approach. What we want to do is we want to look at the underlying root cause, the neurological cause, or sometimes the biomechanical cause that's causing the migraine headaches. And the great thing is it can provide you with a phenomenal sense of control once you can get your migraines to reduce and you're able to control them. So if you're interested in finding out how we get such great results with headaches and migraines, what you can do is you can go underneath this video, and you can see there's an area where you can put your name, you can put your email in, and what we'll do is we'll email you out a a full report that will go over our therapies, our treatment strategies, our testing in detail, and we'll also send you a full-length video on migraine headaches. And that video will go over all the causes of migraine headaches, chronic tension headaches, and we'll go over all the specific therapies that we do in our office to help patients with these issues. So if you're serious about migraine headaches, getting relief, put your name, put your information in, and we'll get that information out to you as soon as possible. Thanks a lot.